All right, folks, let's get started. So if you can all grab a seat, pour yourself a glass of water, or have your coffee or whatever, and we'll get started with the afternoon session. I hope you all found the breakout sessions as interesting as the one I was in. All right, so I'm going to now, well, as you know, there's going to be a major handover that I'm going to make to Astrid in a couple of weeks when she will assume the role as interim CEO. But I'm going to do another handover right now for the rest of the afternoon as Astrid will take over the program here. Astrid is someone who needs no introduction to this group. I'm going to do it anyway because it's something that that she more than deserves. I've been really fortunate to work with a lot of fantastic people at ICES, but Astrid has really been one of the best. We've worked together for, what is it now, 20 years or something like that at ICES as scientists, and then in the various roles that we've both occupied. And certainly in the last years that I've been CEO and with Astrid as Chief Science Officer, it's been absolutely fantastic to have her as a colleague, to have her as a key leader of the organization and an amazing ambassador to the organization, and someone who is not afraid to tell you what she really thinks, who always speaks very honestly and with great passion about the mission of ICES. And my only piece of advice to you, Astrid, is that you might want to work a little bit on your poker face, because one thing about Astrid is it's always very clear when she doesn't agree with you, because long before she actually says anything to you, you can see it as she starts to kind of furrow her brow a little bit. And anyway, that's all good. So Astrid, please.
I actually think that's Michael's way of telling me I need some Botox because I have a very furrowed brow. It's a pleasure to be moderating this last session at this wonderful day. So this is a session about partnership between researchers and community organizations. I was thinking as I was going to frame it, this is almost like the antidote to this morning of the brave new world of AI and, people whose friends are now chatbots and all of that. But actually, I was very struck by Amal's comment, it was a comment in response to a question about, inequities that can get really baked in and probably worsened by AI, and how do we mitigate that? And his comment about, he talked about a grant where there was money in the beginning to develop the grant, but very focused on community engagement. So there's obviously a big role for this kind of engagement. At ICES, we're very committed to community engagement. We have increased the number of people that we have in our public and community engagement group, and they do fantastic work. Certainly during COVID, we started to work much more closely with community organizations, and we really are trying to get the word out that we exist and that our data could be used to serve their purposes. And of course, we have this fantastic applied health research question stream of funding, which some of you may have gone to the breakout session about, which does allow community organizations to, access data. But I have to say, there's nothing like hearing from people who are doing great work together to really be inspiring. So that's why we brought this panel together. There are bios, and I am going to ask everybody to sort of situate themselves a little bit, but I will maybe just very brief introductions. All the way to my left, Ashley Smoke is a peer researcher. She works with Tara Gomes, who's one of our senior scientists. And then Kimberly Floyd is the CEO of the Welford Community Healthcare Center, CHC, and Beju Shah, another one of our senior scientists. And there will be time, a little bit of time for questions. So same thing as this morning, where we have 2 mics. So I will try to keep on time so that we do have a little bit of time for some discussion with audience. So I was going to just start sort of by, they're sitting in sort of their teams, so maybe start, Kimberly, with you, just to, if you could just tell us a little bit about yourself and then, how you came to be involved in research with Beiju.
Great. Although slightly intimidating, all the brains in this room, thank you for staying. I'm really excited to be here today. I have been a clinician. I've been in healthcare a very long time. And I think what really has brought me to the opportunities around research are that thing that brings us to healthcare in the first place, about wanting to make a difference, but wanting to make the right difference. There is so much pressure to improve the healthcare system right now, and we need knowledge and we need innovation to be able to move it. And so I am biased to action. Sometimes, if some of you know me, I'm pretty bold about let's go and let's try and innovate. But we need the question to be asked in the right way so we can measure and monitor and see if the things we're doing are making a difference. And so I've had the privilege, not only working with Beiju, but with several other really compelling researchers in the fields, to ask how do we bring the knowledge that comes from research and actually make it actionable that we can implement. I think for us out there in the field who are really trying to make some differences, that orientation around action is critical. And so I really get excited about coming beside those kind of projects that are going to not just say what the issue is, but how could we look at addressing the issue. So that's where I've come from in this journey so far.
Great. And then Beiju, maybe you can comment a little bit on the project that you're working on with Kimberly and just more about why the engagement is so critical.
Yeah, sure. So the project that we're working on is actually part of the work and funded through the Network for Healthy Populations, which is a research network at U of T focused around diabetes care and really moving into action, right? So no more descriptive epidemiology, but actually doing things to improve care for diabetes. And this is focused specifically in Peel region, but obviously can be spread and scaled beyond that. And so the project that we're working on really evolved out of a process that was developed at the network to really identify areas and priorities for Peel and for practitioners working in Peel for what they wanted to do to improve care. So, for example, in our case, it was really around coordination of access to diabetes education in Brampton. So Kimberly works in Brampton, her CHC is there, and our goal was really to try and create sort of a central navigation hub for the very high burden of diabetes that exists in Brampton and the very sort of scattered, disparate, disconnected services that are available throughout. So we've started with coordination to diabetes education, so to a nurse or a dietitian to support patients with diabetes self-management and dietary adjustment, insulin adjustment, those kinds of things. And piggybacking that into existing networks that are around in the region, and then working towards building greater capacity and greater data, really to support and to justify why we need to do more work and collect more data and do further investigations. So, I mean, the community engagement was sort of like pivotal to the whole thing. Like, it started with this working with people on the ground in Peel and identifying what were the priorities and what were the needs. And Kimberly, as a forceful advocate, was able to sort of enunciate this as a key priority for her and for her team. And so then we were able to bring together me and some other researchers to kind of come together and create the program based on community need and building it in a way that could be evaluated and rigorously sort of become a research project to justify then, further funding, for example, at the end of the day.
Great, thanks. And then maybe we'll move to Ashley. Do you want to talk a little bit about yourself and then how you came to work with Tara?
Honestly, I don't even remember how I came to work with Tara.
So memorable.
It's been a while. No, I started this work because I have lived experience with substance use. I used drugs for 20 plus years of my life, and I lost my son. Well, I didn't lose, I lost custody of my son. And I looked at the system, because I worked in harm reduction, I was educated in community services, and I was looking at the system going like, this is not what they taught me in school. This is not how people should be cared for. This is not support. These are not systems that are working. So I started to advocate, and I started to really try to find out, like, how could I really make a difference? And through my journey, I found research. And then I started looking at research being like, there's a lot of numbers and data that, like, I can interpret and make sense of and, like, understand why these numbers are the way they are based on my experiences in the community. But I don't think the researchers were putting some of that stuff together necessarily. So I made it like a mission of mine to try to bring that community perspective and all the stories of my community members and my friends and colleagues. And I tried to really like amplify them and try to, you know, just bring like a human perspective to research so that we could make some changes and we could, you know, advocate for policy change and make a real difference with the research we're doing and not just spending money on data to have data, but to like actually impact people's lives. So I think that's how I got into research. Working with Tara has been really helpful for me, just in learning how research is done and how the process is and how to translate the information not just to the community but to politicians and policymakers and people that make the decisions with money and those kinds of things. So for me, it's been like a really great positive learning experience and a really great relationship building activity with my friend here, Tara. And it showed me that, because when I started this work, I was intimidated by a lot of the researchers and doctors, and I was like, I could never work with them and do that work. But now I find myself in the rooms with the doctors, and I see them more as like friends and colleagues than like bosses, and you know, like, and I think that relationship building is what has helped my work and being able to learn the things I've learned and bring that knowledge to the community. And yeah, thank you.
Thanks. And Tara, what about you in terms of like the importance of, I know it's not just Ashley, but you know, a lot of the kind of engagement work that you've built into your entire program of research?
Yeah, I will say that, you know, I love presenting and speaking with Ashley because we've got a good dynamic here because so much of what she said is exactly kind of the place where I was in about 10 years ago where we were doing work with the ministry. We had ICES data and the ministry really cared about opioid-related deaths and we were really engaged. But as many of you know, because it's so nice to see so many friendly faces in the audience, you know, I'm not a clinician by training, I'm an epidemiologist by training, and I didn't have any sort of direct way to engage with people who are being impacted by the work. So people who use substances, people with chronic pain, and I felt like there was this major gap for me in being able to understand the implications for people who are ultimately going to be impacted by these policies. And I was increasingly realizing how complex this area was, the intersection of pain and substance use, the intersection of the prescribed opioid environment and the illicit or unregulated drug supply, and recognizing that the numbers that we were pulling, while helpful, were never going to tell the whole story, and that I, as a researcher, was never going to be able to understand the nuance and the complexity of this. And neither were policymakers or politicians, that it really had to be bringing together people who were working across the different sectors and people who were directly impacted to try and better contextualize what we were seeing. So that is what really led me to want to do this. I find it, it might not be surprising that Ashley says that she was kind of intimidated around, people who are doctors, et cetera. I was super intimidated to go and talk to people like Ashley. I was worried about saying the wrong thing, doing the wrong thing, being seen as somebody who just doesn't get it, doesn't understand. And I realized that I just had to try, right? I just had to go out there and realize that these are people who care about their colleagues, their peers, and have so much information that they can share and so much knowledge that they can contribute to this. And I just had to talk to people and become friends, as we did, and figure out how to work together and how to integrate that into our work. So that's really kind of where I came into this, was recognizing the gap and the need and just kind of jumping in and trying to forge those relationships so that I could make sure that as I was doing my work, I wasn't contributing to potential harm for some communities by not recognizing the reality of the lives and situations that people were facing. So I'm forever grateful that Ashley and others who work with me have been willing to do that work and to share their expertise with me, because it's been incredibly valuable to me, and I've learned a lot from all of that work as well.
Yeah, so then maybe I can ask a little bit more, and actually both of your answers reminded me a little bit of Elder Mark's comments about some of the teachings, and humility being one of them in terms of, but like just for people who want to get started, or people talk a lot about making sure partnership is meaningful and not tokenistic, and so just sort of some of how you went about like building the partnership.
Is that
Either one of you? Yeah.
I could start maybe just how I kind of went about it. So when we started, we got a grant, and before we started that grant, it was around substance use. I talked to my team and I said, we need to go out and talk to people who are going to be impacted by this, and I don't know how to do that. So we're going to do focus groups. I'm not a qualitative researcher. It was not a qualitatively sound focus group, if there's any qualitative researchers in the audience. But I said, I just need to meet with people and talk to them and hear about what their priorities are so we can build that into the grant. And that was my first foray into this. We did that. We actually went around the province and held these focus groups. And afterwards I thought, we can't stop here. This isn't, we can't just stop at this point. I've met so many incredible people who have so much to offer. So we actually then kind of gathered what we call our lived experience advisory group from many people who we met through those focus groups, and then it's evolved. Ashley joined a couple of years later, and it's evolved over time. But it was really about just taking that first step and recognizing again that you might be fearful, you might be worried you're gonna say the wrong thing, but just take a moment, find some people to talk to, have an informal conversation, and try and understand what their perspectives might be and how that might relate to the work that you're doing, and then see how it can snowball from there. The other thing I will say is that compensation is really important, and sometimes I find that people are fearful of getting into this because they're worried about the cost, right? We have grants, we don't have that much money, how can we possibly do this? And I will say you don't have to start huge, right? So when I started, we had some people with lived experience who were working with us. We were paying them $40, $50 an hour. It actually doesn't have to be an enormous cost to your grant to actually do that meaningful engagement with a couple of people across one project, and see what you get out of it, see how it works, and then use that as leverage in your next grant to be able to expand, right? So I think that as humans and scientists are sometimes fearful of getting something wrong or of not doing it perfectly right the first time. I think if you go in with good intentions, you talk to people and try and learn the best way to make it a mutually respectful and beneficial relationship between yourself and the person that you're working with, or the people, that you really can't go wrong if you come forward, like you said, with humility and with respect, and try and create that trust over time.
Can I build on that, Astrid? As an agency coming forward to want to make sure that our clients' voices and the community are really heard in research, I just want to do the flip side. Tara said it's kind of intimidating as a scientist coming in. It is very intimidating also the other way. Are we going to see an issue the same way? How do our biases play out? How do the knowledge of what we've heard from the field and sometimes what research has taken, or a particular research question goes in this way when really you want to show the holistic issue at play, and how do you manage some of that tension? That's certainly something that we feel in some of the work we've done. And it is, I think, that building trust, that having relationship, to have some tough conversations about, well, why do we want to do it that way? And what about this? And this is missing. And if we don't ask this part of the story, we're going to miss everything. So I think that has been really critical for us. For us as an agency, we really want to support that evolution and innovation. And yes, there's things like quality improvement, but the opportunities to really take data and unpack an issue in a new way is very exciting. But that means you also, for us as an agency, we have to bring our teams along. So part of the goal for us is actually building capacity within our teams to understand, what kind of questions we want to answer. And then when we're sitting down with researchers that we're going to partner with, say, they may come with, this is the research angle we want to have, but then after some of those conversations that Tara talks about, then we really open the topics up. The other piece I would just say that is also intimidating is how data is created, used. We've talked, I know, today about, that ownership and how that's used. But there are still a ton of blind spots where we're not collecting data. When we look, and I'll just use one example, and I don't mean to be polarizing, but when we look at a lot of the data sets, it's acute care driven, it is, physician driven, and for agencies like us who are very much comprehensive primary care, all services, we actually want that data to be real-time, community-based, not just some of the bigger centers that have the resources and the accessibility to data. And that's a tough one to come over. But for us, being a bit of trailblazers, it's the willingness to just start and get moving.
And I'm curious, Beju, like in some of what you've described, Kimberly, even the capacity building. So do you see a role for researchers to be part of some of that capacity building, or do you see that as your role as the organization?
It's a partnership, in my opinion. There are things that together we can actually bring about better change with both of our brains. And Beju and I were just talking today. Do we see the world differently? Well, yeah, but the combo of how we can bring the world together is where the magic is. And that's what, in a center like ours, we're really aspiring to. We're trying to move the organization to be data-driven. We don't really have the tools. We have a lot of good support from the ministry coming around some things, just like AI you spoke about this morning, but we still are doing it off a bit of a shoestring, and sometimes it's old-fashioned, not the pretty ways to collect data. So we need help to think about how to do it different.
Yeah, and I think another important part of the work that we've done is the qualitative part, right? I mean, I think we are at ICES, we're very used to and very comfortable with quantitative data and doing all the sophisticated analytical techniques to find inferences and correlations and so on. And that's all obviously important, but the contextualizing and the interpretation and the understanding really comes from the qualitative piece. And that's where the partnership really comes to the fore, because when we're sitting in V-Wing, it's hard to kind of do that, right? You can't just, how do you contextualize these data? Well, through the partnerships and through the people on the ground and working with providers and patients and clients is the way to really build that richer, deeper understanding of the data and what the quantitative results really mean.
Yeah, and on that, and maybe we'll pass it back to Tara and Ashley. Can you give an example of something where, the output of the partnership has really changed because of it? Like just, a very different way of...
So I have a lot of stories about this, but in my experience, the best engagements the best projects that I've been a part of were ones where there was a two-way reciprocal relationship. Like, I'm not just giving my experience to the researcher for the benefit of the research, but they're also providing the knowledge, the training, that capacity building in ways that are accessible to me and others. So there's been so many, but also like with Tara's projects, we have a lot of access to like politicians and people with influence, and I think like that partnership has been the most beneficial, not for like me personally, definitely not for me personally, but like for the work that I do and the ability to make change and to impact people's views and the way they see people who use drugs. I think that has been really helpful. Is like Tara, I'll bring a problem to Tara, and Tara will get me in front of the person who needs to hear the problem so that change can be made. And I think like just like having that adaptability and being able to pivot and like meet people's needs, meet them where they're at, see what's important to the community, and then address that issue. And I think that's been very helpful. I know it's not easy to do, like some projects are very like narrow in scope, but I think wherever possible, just like also letting people from the community lead the work. Don't come to us with the question. Develop the question with us. Don't just create the methods and bring it to us. Develop those methods with us in collaboration. I think those kinds of things have been the most successful in terms of like the community engagement aspect, but also the outputs and the actual like papers that are written even come out way better, and just like the knowledge translation pieces come out way better. Just like the whole overall outputs are so much more valuable than they could have been otherwise without that engagement.
Yeah, I mean, I totally agree. And I think that one of the things you're getting at is that idea of reciprocity. And I think we often think as researchers around patient engagement, around you've got a project and you engage them and you get an insight and context. I think what we've developed over time, and I will say that we didn't start this way, and this is part of what you kind of learn and build towards, but with our lived experience advisory group, is that we don't meet just to kind of say, here's our needs as researchers, tell us what you can to help us get this project across the finish line. We started off at the beginning having more traditional agendas like that, right? We've got this project, we're going to show you this data, we want to know, here's some questions we have. And we realized very early that we didn't actually find that was super helpful. I mean, it was helpful for us, but we didn't always feel like it was a comfortable conversation. There was a lot of silence. We didn't feel like, just the vibe of the group didn't always feel quite right. And we realized pretty early on we had to kind of change that approach. We had to kind of ask people, what do you want to talk about? What are you hearing about in your community? What do we need to be thinking about now that could inform projects or work or just connections that we can make with people in government or people in community-based organizations, communications we can make about a risk or a concern that you're hearing about that we can amplify. So how can we understand that? And then that kind of builds into these conversations that inform and influence how you do your projects and how you interpret the data. So it was really a bit of a shift for us as well as to the traditional way that we do research and hold these meetings, and thinking about how we don't just take all the time in these conversations, and we realize that this really has to be a partnership and there has to be reciprocity there as well.
Yeah, it's a really nice...
Yeah, and I mean, that's kind of how we met, right? Was exactly in that kind of a scenario where we were sort of sitting around a big group of tables like this and saying, okay, what are the priorities? What are the needs? Mm-hmm. And that's how the things sort of evolved from there.
Yeah, I like this piece also just so much about the reciprocity. And one other thing, Ashley, when you were talking, it makes me think, like, we're always, as researchers, like, griping about we don't have enough money, we've got, like, my grant's just been cut by 23% by CHR and all that, but we sort of, and a lot of us are, many of us are also in the healthcare system, and I think we kind of underestimate our social capital, and that's a really, A, social capital, and B, the fact we have grants, right? So it's, we do have access to ways to, be able to make the work happen and to compensate people and to, have it be more reciprocal for sure. Yeah.
And you have the data, like,
Yeah.
you have the data that we need. And it would, like, if we could guide you in how to, better utilize that data to help our communities, like, that's like the goal, right? So, yeah, I urge you to work with community members so that we can get that data out there, because we need it really bad.
Yeah, and that's actually a nice message to us as an organization, not just to individual researchers, right? And again, we're trying to get the word out because, again, we do feel like, our data should be useful to, it's Ontarians' data, so it should be useful to Ontarians, so for sure, yeah.
Astrid, can I just pick up on your
Yeah.
point? We're also one of those that often bellyache not having enough dollars. But I think in addition to supporting people with lived experience to really be able to participate without barriers, I think agencies like us who can also do a lot of connecting the dots to a critical mass of people who experience the healthcare system and social care system, we get intimidated too because we're going to do this off the side of our desks. And yet there are some really passionate clinicians and partners who want to be able to do this. But where is that creativity around just a little bit of support to make sure that it's dedicated? For us at our organization, it's a strategic priority to make sure that we participate and help influence innovation through research and growth and curiosity, quite frankly. But sometimes there does need to be a little bit of some resources left so that we can do it really well and not just sometimes. And sometimes even Beiju feels that, right? Something's due in that report and oh crap, I don't have time and I can't delegate that, but we'll figure it out. But that investment in communities and agencies to support it is also important.
Yeah, and I'm wondering, is that always money or sometimes it's, you don't
It can,
right? So
exactly.
yeah.
It can be both, right? Or, that researcher or research associate that actually might be able to come in and plant inside your organization, a day a month or something to actually be alongside our team to help pull the data and look at things and help co-lead a focus group, because we already have those focus groups and those opportunities to connect with people with lived experience really easily. We just need some of the knowledge and support to do it.
Any other pearls of wisdom before we turn it over to the audience to ask questions?
You always have pearls of wisdom.
Oh, advice, unvarnished advice.
I think when it comes to, like, it's not just money, although money, like, we really need it. Sometimes it's time. And the timelines that we have in research and, like, with government grants and all that kind of thing, it's not enough time to do engagement well. Like, I'm Indigenous, so I work with a lot of Indigenous communities, and it takes sitting down with elders and council members and chiefs and, like, having conversations and coffees and going to the res and, like, actually meeting with the people, and travel and time and money and, like, all of these things are needed to engage with one Indigenous community, let alone all of the ones that we have. So I think we also need to build in time for that proper engagement. And it's not just Indigenous communities, even, like, people who are homeless and people who have used drugs, like, all of these different communities have their own unique needs, and it takes time to build those connections and those relationships, and that time needs to be built in. Yeah.
Somebody this morning was talking about the speed of trust. I think it was Sean, the Assistant Deputy Minister. So that's an interesting phrase. So yeah.
Speed of trust,
Yeah.
I like that.
Yeah.
Yeah, I think that's really important. I think that's the one thing we often struggle with, and I've struggled with. I'm an impatient person by personality. I like to get things done and move on to the next thing, and it's something that I've learned a lot about in a lot of these different work projects I've done, both Indigenous work with the Chiefs of Ontario, as well as just the broader set of patient engaged or engaging people with lived experience in the work, is that you really do have to build in that time to build and foster that trust and to build, friendships and collaborative relationships with people, because that's in the end what we all do as researchers, right? We meet each other, we get to know each other. It used to be we'd have coffee in the G-Wing somewhere, and then you might, and that takes time to build, and it's exactly the same way with people with lived experience and lived expertise who you're engaging with or other community organizations, and you need to be patient with that and not rush it, because if you rush it, it will be clear that you're just in it for the end goal of saying you've done that work, as opposed to the actual relationship and the knowledge and the partnership together.
And if I can just add, to honor that contribution that people have made to this work, it's also then doing that other end. So now you've finished a project, you've got some great things that have come out of it, a bit of a aha. Well, now how do we share that? How do we really do that knowledge translation? And maybe it's like walking alongside us to help promote to the rest of a sector or the rest of an organization, and really let the users have the voice in presenting some of that information. It has more credibility. So really creating some of those spaces that knowledge translation can really happen and take off.
But I think the other thing I think I've taken away from this also is that it's important, it takes time, but it doesn't take as much time as you think it might, right? Because I think that was one of the intimidating things for me at the beginning, and we were talking about intimidation before, is how do we even get started? How do we do this? How do I, how does this work? And it almost kind of comes naturally, right? Because we're all, in the end, trying to get to the same place, right? So, and it's not just us, our teams as well, right? My research coordinator, your nurses, we're all trying to go in the same direction. And so just those regular meetings where we get to know each other, get to talk, get to share ideas, get to start, moving forward on the project and the plan, it helps foster that, and it helps move things along and build that trust and build that relationship, because everybody wants to get there. So it's not as hard as it may seem.
Yeah, that's good. I think our academic institutions still don't make it easy for people, especially earlier in their career, right? When they're very focused on still those very traditional academic outputs, and lots of them, and all of that quickly. So, but
yeah, that's true. I mean, and that's the luxury I've had, right? This all started just after I got my full professor, so I don't care anymore, right? But that's
Yeah. We have about 15 minutes for questions from the audience. Two microphones sort of there and there. All right, thank you.
Good afternoon, everyone. Thank you so much for your wonderful panel conversation. My name is Sabella Yusuf Homnad. I'm an officer within the Public Community Engagement Knowledge Translation Office, sorry, it's a longie, at ICES. I had a question regarding community engagement and your partnerships. How has that partnership filtered into other engagements? For example, I know you mentioned, might be with policymakers, especially in issues that are, quite provincial, national, topical, contentious. How has the partnerships that you have benefited when, work led towards, for example, policy area? If you have an example. Sorry if it's a deep question.
I mean, one thing, and Ashley hinted towards this earlier, or spoke to this earlier, but is one of the things we've actually changed probably in the last 3 or 4 years. It got a lot easier during COVID. One of the things that got easier during COVID was we almost entirely co-present now with somebody with lived expertise, especially when the audience is somebody in a position to make change. Because I think, and I know that some people maybe still in policy around the tables here, is that often policymakers don't have the opportunity to hear directly from people who are influenced by policy as well. So whenever we have webinars or presentations, Ashley is a great friend to me in agreeing to go present, and as you can tell, is a really impactful speaker, and many people on our panel and other people we engage with are willing to do that. And honestly, at the end of the presentation, everybody's so thankful for their time. Like me, I'm, whatever, yeah, you talked about a bunch of data, but the advice and the insight that is shared by people with lived expertise who co-present with me is always far more impactful than any numbers that I have to say. It's helpful to back it up with the numbers, but hearing directly from people is where I have seen the power of that messaging. And so that is something that I've really learned in the last few years, and I think, again, to that reciprocity, I shouldn't just be talking about this because I'm not the only person who led this. And so it's kind of honoring that contribution and recognizing that contribution, and also recognizing that I can't do justice to that lived expertise and context that is being provided. And I think that has real impact. We've presented even to, the Treasury Board, which isn't necessarily a part of the government you would think is making, working directly in health. But Ash and I spoke with them about this work and about, what we see being needed from a research and from a kind of community-based perspective. And that was really powerful for them. We got really incredible feedback from them. So it's really being strategic and thoughtful in that shared communication.
I think also it's not maybe like changes in policy, but like for people who use drugs, especially like for me, it changed my whole life being able to do work like this and to learn that my voice has power. Like, it's not just like we're helping research, but we're helping ourselves. We're helping, we get so much out of this in terms of self-worth, skills, just like feeling like a human again. There's a lot of different things that we get from engagement that have nothing to do with the research at all. But also, when it's done right, when a project ends, you would hand it's not like you just stop all engagement. You keep these relationships and you remember them for the future projects you might have. And for instance, I was on a project with Carol Strike and then it ended. So then I got introduced to Astrid and Andy, and now I'm on a different project about perinatal opioid use. And so it's like that constant collaboration and engagement also helps fuel our careers, actually. So yeah, I think there's a lot of different benefits, and it's not just policy and change, but it's the change you can see in people's lives too.
And just a small P example from a community organization perspective, we were going to go one way on how we were going to try and tackle diabetes navigation. And by pausing and looking at the research, trying things out, doing some of this action-orientated piece, we actually changed our whole direction. And it actually has also gone hand in glove with working closely with our Ontario Health region about what some of their vision and their investments, which is really exciting to us, that will make sure that the work we've started now with some really solid data and some fine-tuning. We've changed a bit of how some of the intake is going to work now because of this project, that now we're actually going to see it invested, and we could have taken a really bigger risk of trying to go it alone and go this way. Now we've come together with this committed plan moving forward, and the research was the driver of making sure we did the right thing.
All right. This is a bit of a heavy one potentially, but first of all, thank you all very much for sharing your stories. One thing I've been reflecting on a lot lately that was really spinning in my mind as you all were sharing about some of the experiences of being intimidated and afraid to say the wrong thing. And I think often in these spaces, these cross-sectoral spaces, no one's fully comfortable and no one's fully in control. And one thing that I think is a very valid observation and criticism of our maybe progressive work or equity building work is this concept of purity politics, where this holier than thou idea, and we're afraid to make a mistake, or this toxic perfectionism, right? And I do notice at ICES and in the sector, there's sort of this norm of learn, then do, rather than learn by doing. And so I'm wondering if any of you have advice from your own experiences kind of overcoming that toxic perfectionism and being mentally ready, the changes inside, to step into that discomfort zone and be more willing to learn by doing, and how we can all kind of get there too.
Who wants to take that one?
I mean, I think you've described it perfectly. It's hard and it is uncomfortable. And at some point for me, I had to just accept I was going to be uncomfortable and that I might make mistakes and realize the risk of not doing it. And so for me, I was seeing there were some people I really respected in community that I'd kind of seen from afar who would sometimes kind of call me out, and this is just being totally upfront, like call me out on some of the work and be like, you don't get it. You don't get it because of what this is happening. And it would be demoralizing for me because I was like, I've tried so hard. I care so much, but I'm trying to do my best here. And then I took a step back one day when we'd done, it was an ICES media release, and I'd done this media, and then somebody who I really respected tweeted kind of like, you just don't get it. And it hurt me. Like, I was really upset about it because I thought, but I'm trying my best here. And then I thought, you know what, they're right. Like, I haven't talked to them, and I know and respect them. Why haven't I talked to them? And it was legitimately because I was afraid to. I was afraid of what they might say. I was afraid that maybe what I'd done wasn't as good as maybe I thought it was. And so I emailed them and was like, can we talk? And that started me down a road of then kind of coming into this. So there's a degree of swallowing your pride. There's a degree of, we're trained to kind of say you've done all this great work and you're an MD or a PhD or a master's of public health and you're an expert in your field, and accepting that you're not actually an expert. You're an expert in a part of that field. And so being willing to be uncomfortable, step into it, ask people that you're intimidated by or scared of to actually just have a conversation. And that was a real turning point. Like, I remember that day. I remember that tweet, and I remember that moment. And for me, that was a massive turning point in how I reacted to that, because I could have become defensive and just doubled down. And I'm not saying this to kind of, pat myself on the back, but just to say that I had to just take a step back and then just say, you know what, I'm going to try this and see how it works. And that led me down a road that I think has been really personally, important for me, and also I think has really strengthened the credibility and the quality of the work that we've done.
Tara, is that the project we did together, or is that a different nasty tweet?
No, that was a different one. Okay. I have developed a thick skin.
I just have to commend you, Tara, for
You'll be back.
the vulnerability in laying that out. What we see in the community, the knowledge and the access to data that you all have is a huge privilege. And not everyone who comes from the community has that privilege. And they also don't trust often. And so that humbleness, that ability to be with people, along with people, is really something. And even for the clients in our center, that we're going to use their data or we're going to involve them in a focus group or whatever, it takes a long time to reassure them. These are equity deserving populations who don't trust the healthcare system, who have had experiences of bias throughout their lifetime. And so it does take that time, and I think that partnership and that openness that Tara just talked about is critical to make that work.
Thank you. Michael, do you want to?
Sure. Is there still time? Or is there anyone else who?
Yeah.
Okay. Well, first off, I just want to say that the theme of today is about innovation, and AI is something that's been talked a lot about. But just think about innovation and advancing healthcare. I just want to commend the work that all of you represent, because I think this is a fantastic example of innovation in our work at ICES and other research groups, and engaging with frontline provider organizations, community health centers, and people with lived experience. So that's absolutely fantastic. My question, though, is, when you're talking about engaging with community, there's not one community. There are multiple communities. There are multiple points of view. And I'm curious, there's sort of a sense that we're all trying to achieve the same thing, and we sort of figure out, and we get all are eventually rowing in the same direction. But there's got to be times when you're not actually hearing consensus, or there are different points of view that may be not quite aligned or even diametrically opposed to each other. So I'm just curious so what's your advice in that situation? If you're doing an authentic engagement that is really broad-based, you're going to hear different points of view, and especially in more controversial areas. But even think about diabetes in different ethnic communities, I'm sure that there's going to be different attitudes towards some of the healthcare approaches, and even more so probably around people who use drugs. And so just some advice to those of folks who are working in this space, how to address that, how to not be afraid of those conflicting voices when they arise, and how to potentially resolve them so you're still managing to move forward.
So, I mean, I think the way I would view that is similar to sometimes you'll run into controversies or disagreement in a research setting, like just among a group of researchers, right, where you'll have different perspectives or different ideas, and it kind of navigated in the same kind of way, where you talk it out, figure it out, see where you can find areas of agreement and agree to move forward there. Where there is disagreement or controversy or lack of consensus, try, punt those if necessary, or find a way to work around that. I think our experience with community has been less about disagreement, but almost more about over-engagement, where people like Kimberly are involved in so many projects that she doesn't have time to take on yet another one that she would like to, right? Or that we're going to the same people over and over and over for their input and their advice and their collaboration on this work, and yet there's other people who are just not engaged. We know they're there, or maybe we don't even know they're there, but don't have the resources or the time or the interest or whatever to get involved in the research. And so that, to me, is almost the bigger issue, is who are we not hearing from? And maybe they're the ones who are actually disagreeing with us in a lot of ways, and we just don't know about it. And I don't know that I have an answer to that.
Although we do iterate often, and sometimes I'll nudge them and say, but we'll do another one, right? We'll go back and do another research study that shows some of the other angles. So it's a partnership that now I think will continue to grow, but I acknowledge those diverse perspectives sometimes really will raise their head, and that's where we try and iterate when we are in it.
Yeah, I can give an example because, working in the space of substance use, opioid overdose is pretty contentious sometimes. And one of the things that happened early on, I mentioned those focus groups we did and pulling together the first formation of our lived experience advisory group. We had done those focus groups with people with chronic pain who are using opioids, prescribed opioids long term, and then people who are using opioids from the kind of street supply. And we brought people all together from across both of those kind of domains of exposure to opioids and use of opioids in this advisory group for the first couple of years. And it worked a bit at the beginning, but actually it became problematic. So exactly what you're describing, Michael, was there were, especially for some of the patients with chronic pain who had experienced massive changes in access to prescribed opioids because of the concerns around opioid toxicities, et cetera, there was a bit of an us versus them mentality and this desire to differentiate themselves from, those people that used drugs in other ways. I use it properly, you don't. And it created an incredibly unsafe dynamic in our committee that I didn't know how to handle, because we wanted to listen to and understand the different perspectives of people being impacted by these policies and these changing environments, but it felt really unsafe. And so we had to make some hard decisions. And in the end, we actually moved ahead. Our work was going in the direction of working directly with people who are being impacted by the changing illicit drug supply and a lot of that work. So we used that as a moment to reframe and reorganize our advisory committee and really be very careful in who was part of that committee to make sure that it had diversity of experiences with prescription and illicit opioids and with geographically and across a number of different domains, but that we were being thoughtful in people who might have that different perspective that was a valuable perspective, but not for the specific research projects that we were planning. And we continued to engage some of the chronic pain patients on very chronic pain specific projects. And they were very difficult conversations to make that transition, but it was necessary. It was really necessary. And I think that our committee became much more effective after we made that change. But it was something I hadn't anticipated. I just say that to say that this isn't always a smooth road, and there are bumps along the way, and sometimes you realize maybe you should have done something a little bit differently. I think it's taking those moments to recognize what those dynamics are and if you need to do something to change it, to make sure that the people you are engaging are doing so in a way that is safe and meaningful for them, because there were people who had to step away because it was actually not a good environment for them to be in, and I don't want to be someone who's asking people to be part of that environment. So you have to be very thoughtful as you do this work as well about who's around the table and what the terms of reference are and what the rules of engagement are, to make sure that everybody's working together. And now we've hit that beautiful stride where I think we've got this wonderful committee and everybody knows each other and trusts and respects each other, and it's great, but it takes some time sometimes to get there.
Sounds good. Any last thoughts on that? All right, we are exactly on time. I want to just thank our 4 panelists very, very much for a very inspiring conversation, really important work. And, Michael talked about like the theme of innovation, but I'd say it's also about connection and partnership, really, really important, if you want to call that innovation or not, or just like really basic and really, really important. But anyway, so thank you very much. So join me in thanking the panel. All right. What a great day. As I just said, like to me, first of all, and many people have said that, but it's great to see so many people in person. It's been a long time. We are spread across the province and lots of partners in different buildings or buildings that are undergoing renovation and all of that. And it's really nice to get everybody in the room together. I always also reflect a little bit on, the fact that there's so much work that goes on in the background at our organization, from the legal team that's got to put together data sharing agreements, and our data quality and management team that cleans data and makes it all so that we can use it. Our finance team, human resources, law. So I think it's great to have everybody here because we really have had like a wonderful showcase today of the range of work we do, and certainly all of that's only possible because of all the different types of work that have to go on. I won't kind of go through the day, like I'm sure all of you, like I am, are sort of digesting it, from the new world we are in, AI, the good, bad, and the ugly. I'm glad that Deputy Minister Richardson said it's not all about AI, but a lot of it is going to be about AI, it sounds like. And certainly, to this point, and that came out loud and clear to me, it is a bit of the Wild West. Certainly there's going to be ways in which we're going to be able to process data so much more quickly and do some of our work, but just also lots of minefields. And as the ADM, Sean Twyford said, it's not for government, it's not going to be able to solve it all, and probably all of us sort of thinking about what kind of guardrails we need, how do we use it responsibly, take the good, and hopefully there won't be so much of the bad, is really important. I thought Kimberly's, what she said about like data as a privilege, like that really sort of stayed with me as well. And as I mentioned as well, this whole notion of the speed of trust and how important that is in building really important partnerships that totally, I think, change the way that we do research, change the kinds of questions that we're able to ask very much in partnership or think about doing, and then this, really the mutual capacity building. I wasn't able to go to all the breakout sessions, but I heard great things even in the sort of 10 minutes that we walked over from people, and certainly like so many wonderful topics. I did want to, is there a slide up? Thank a few people. Is there a slide up with some names? All right, I will try and do this. So first of all, just a big thanks to Sally Clifford and the face-to-face team. We've been working with Sally for years, both on this forum, and we hosted a great event in Banff years ago, and it's always amazing to work with her team. Everything went off really, really well. Also, our own communications team, so Misty, Devin, Charlotte, Stella, and Emma. You guys did a fantastic job and really appreciate that. I did want to thank the rest of the organizing committee, Mike, who co-chaired it, Michael, Natasha, Camilla, Aaron, Sujitha, Lauren, Ning, Susan, Daniel, and Peter. So many thanks. It's a lot of time to devote, but to put a program together that sort of reflects, different parts of our organization. And then lastly, I mean, we've heard lots of thanks to Michael. I'm so bad at goodbyes, so I'm just not gonna, oh my goodness. I'm channeling Susan Bronskill, and you know why I'm saying that. But I would just say, and there will be other opportunities, I hope you're proud. There's a lot that we heard today, and things that we, haven't heard about, some of the leadership and the direction and the way in which you grew our organization, be that nationally, all the work with HDRN and really enabling much more work to go on nationally, internationally, through the International Population Data Linkage Network, our partnerships with HDR UK and all of that. I mean, I think we've developed those kinds of partnerships, and then of course locally, and we've heard today as well, about the growth of our community and public engagement department and the work that we're doing. You have to set priorities as an organization, and the priorities that were set by our leader, have come full. Have been on full display, the further cementing of our commitment to Indigenous data sovereignty through the establishment of the Department of Indigenous Partnerships, Data and Analytics, and the appointment of a director, amongst many, many things. So lots of incredible work, Dracula, the Digital Research Alliance of Canada. They're really, really lucky to have you, Michael. And we will definitely miss you very, very much. All right. And finally, Elder Mark, I will call you up to send us off in a good way. We do have, for those of you who can stay, we do have a cocktail reception. There should be, does everybody have a ticket somewhere? Is it in the badge? Oh, on the way out, thank you. On the way out, please grab a drink ticket, and we will hopefully see many of you next year in person again. Thank you very much.
Bonjour again, Mr. Kandodem, Mose Shikode Indigenous, Giwait ZB, Don Jaba. So we have come together at this time, and for all that has been talked about today, we have, we actually have many, what we call wheels of learning, or what some would call the medicine wheel. So to become aware, to gain understanding, to get to the place of knowledge, and then eventually to wisdom. So to walk in a circle 4 times. So a lot of concepts and ideas came out today. Some of them I was able to hear. Amazingly, at lunchtime, Heather and I drove up to North York, and on CBC radio was a thing all about AI. And it was talking about the changes it's going to bring to the universities and colleges, and worried about how it's going to affect schooling and how easy it is to cheat, to use AI to write your papers. So I thought, wow, this is fortuitous timing that they'd be talking about this at, it was on from lunch to 1 o'clock, all about computers and how this is affecting everything that's going on, and even talking about 10 years ago, and how it's changed to this time that we're in. So a lot of things to think about, and how this is affecting everyone in community. So as I said, a lot of things for me. I'm kind of I tease everybody at our ceremonies. I'm kind of a dinosaur. I don't even have a cell phone, let alone a computer. When I was trained, everything was oral. And, I can talk we just finished our fall ceremonies a couple of days ago, and do teachings for 14, 16 hours straight without the aid of flip charts or books or anything like that. So a whole different way of learning and understanding. So this is always interesting to come where, computers are, quite effective at a lot of things. Okay? But the thing that needs to be remembered, and I never mentioned this morning, as part of our human story, we're spiritual beings first. We're physical beings second. Third, we have the capacity to think. Okay? And part of doing work in community is connection to spirit, connection to feelings. Okay? And sometimes when people become a number or a statistic, it kind of takes feelings out of there. And always to remember to have that feeling, that love, that compassion for whether those people are your clients or your people you work with on an everyday basis. We have a concept out west. I've changed it up a little bit. That talks about to make good relations, it takes 1,000 cups of tea. To sit down and get to actually know each other. I'd switch that to 1,000 cups of Timmy's, but that's my own thinking. But it takes that time to build good relations. And when this morning I'd mentioned, well, this area that we're in is the Beaver Bowl Treaty. And originally our ancestors had made this agreement with the Six Nations people, or back then what was the Five Nations, which later became the Six. And then as the settlers come in, the relationship changed a bit, but how we can all work together. We have a prophecy about this time that talks about there would be a great healing would take place across the land. History would get turned around, and Anishinaabe would come to the forefront not only in the Americas, but of the world. I've often looked at that prophecy and, what's it going to take to do that? How can we bring about those changes? Right? So a lot of things to think about. Right? So I'd like to close off with a song here, and it's a traveling song. So part of all of our ceremonies, we ask for good health, good long life, and peace of mind and peace of heart for everyone. And that your journey, some of you have come from a long way, some of you are from Toronto here, and other places, that everybody would be able to get home safe, and when you get home, your families and loved ones would be well. So I'd like to end off with a traveling song here, with a little help from Heather here. Thank you, everyone. Miigwech.